And first, we'll have Representative Huff here. First, I'll start this off. This is we're trying to help the elderly to stay in their homes with the property valuation going up tremendously, and there's different ideas on to do this. One is the discussion whether we need a constitutional amendment or not. The next is whether I had a bill whether it should come from the Senate or House, and Representative Huff is going to carry it. And then we have the PVA from Louisville. Ms. Colleen Younger that is here with some ideas on how we might do this too. So if you would state your name and start.
My name is Thomas Huff, State Representative, Bullitt County.
I'm Colleen Younger, Jefferson County Property Valuation Administrator.
Thank you for seeing us, Mr. Chairman and committee. You've already pretty much said the gist of the bill. We would like to freeze the property tax at age 65 on a primary residence. We kind of feel like at that age you're going to be on a fixed income most likely, and you ought to be on a fixed tax rate. And as Ms. Younger said, we don't want them to lose their homes. So if it's all right, I'll let Ms. Younger take over and explain a little bit about this.
Sure, be glad to. Thank you all for giving us the opportunity to discuss what we call circuit breaker solutions to the erratic real estate market. I'm very aware of how rapidly home values are increasing in our local real estate market. In our community meetings and outreach efforts with the PVA, I hear repeatedly how worried homeowners are about the impact on their property tax bills and their family budgets. It's easy to understand the impacts are greatest on our aging population and disabled persons, leaving many concerned about their long-term ability to stay in their homes. I gave my staff the challenge of identifying and researching circuit breaker solutions that could potentially help homeowners during erratic housing markets like the one we have experienced since the market returned by looking at programs from around the country. We found many examples which we have presented to you digitally and I think today in hard copy. It's important to recognize that none of these solutions exist in a vacuum and can create impacts to the tax base. Special consideration should be given to the potential impacts for home rule cities, fire districts, and school boards. We condensed the list to several that could effectively target the problem while minimizing unintended consequences. In no way are we suggesting these ideas and examples from around the country are the precise solutions for Kentucky, but rather a starting point for legislators to review what other states are doing to offset the problems by the erratic real estate market. The Homestead and Disability Exemption amount is adjusted every 2 years based on the cost of living index by the United States Department of Labor. However, median home sales have risen faster than the cost of living index, creating a reduction in the amount of discount the homestead exemption does give to the taxpayer. So revising that statute to base the exemption on median sale prices could positively impact homeowners receiving the exemption. For example, in 2010, the homestead exemption equated to a 25% discount for median value, while in 2023, the exemption has diminished from that 25% down to 18%, creating a higher tax bill for elders and those on disability. If the exemption was based on a median sale price rather than the cost of living index, the homestead amount would have increased to $57,200 $4,700. However, today it stands at $46,300. As median sales have gone up, homestead discount has gone down. And I've given you all of this information. There's a graph, the history of the exemption, which when it was originally at the onset was $6,500, and provisions were set out in the statute which authorized the exemption to increase every 2 years to reflect the cost of living. But as it is today, the homestead exemption is not keeping up with the real estate market. And the fast real estate market and the higher prices of property are reducing the amount of discount that the homestead is giving. Let's see. The homestead and disability freeze, which Representative Huff and Representative Nemes have proposed, would freeze the value of the home once the property owner qualifies for the exemption to provide that protection for the elderly and disabled from the spiking property values. The exemption could be frozen until ownership of the property changes or substantial renovations are made. Then assessment values could reset to the fair market value. We also found around the country there are property tax deferral programs. That is a program out of Idaho. You've been given that example in the information that we've given you today. So what that would do is that for qualifying homeowners, tax liability that is not paid would become the form of a lien against the property. The portion not paid would not be subject to tax bill sale, and then once the property owner sells the property or passes, the total amount of liens for that non-payment would be paid prior to transfer. There's an interesting program out of Arizona that actually maxes out the amount that you can raise a property value each year. They chose, I think, 5%. To me, that would be a deficient amount. It should be a higher amount to keep up again with the fast real estate market. A 5% increase would keep us running after the fair market value every year. So there are examples of that Arizona program in the packet that I have given you. They do an interesting way, they have an interesting way of assessing. They use the fair market value, but they actually bill on what is called a limited market value. So although they reassess at fair market value, there is a maximum, there's a ceiling on how much that value can be raised. And in Kentucky, it would probably look more like with our market, something like a 10 to 15% increase that would be set. But again, once that property transferred to a new title, it would reset to fair market value. So there are several programs that I've given you to take a look at. I do want, again, to emphasize special consideration on any action taken should be given to our fire districts, to our home rule cities, and to our schools, because obviously any change in the tax row would affect those public safety entities and school entities. So thank you for the opportunity to address this body. Thank you for your time and interest, and I'm glad to answer any questions you might have regarding this presentation.
We thank you both for being quick and efficient, and we're going to be working together on a good bill. We'll take questions, but first I want to call roll and go over the minutes. So,
Senator Mills, Senator Thomas, Representative Brown,
here.
Representative Dossett, Representative Gentry,
Here.
Representative Imes, Representative Johnson,
Here.
Representative Palumbo,
Here.
Representative Raymond, Representative Tate, Senator Mays Bledsoe, Senator McDaniel, Representative Hale, Representative Petrie, Representative Reed, Representative Bratcher,
Here.
Representative Bridges, Co-Chair Fleming, Co-Chair Freeland, Chair Nemes.
Present. Representative Palumbo. has a question.
I just wanted to ask the PVA from Jefferson County to meet me after the meeting.
Sure.
Thank
Be
you.
glad to do that.
Representative Gentry.
Thank you, Mr. Chair. Hi, Colleen. How are you?
Hi, Alan. How are you?
Good.
To see you.
I don't know if this question is more for you or for Representative Huff, but there was a statement mentioned that you're looking for a tax rate freeze for 65 and over. Is this going to include people on full disability that are under 65?
Absolutely.
Okay.
Yeah.
Thank
The
you.
exemption applies to those who reach the age of 65 and also to those on 100% disability.
Thank you.
No further questions. We thank you very much and look forward to working with you on this.
Thank you very much.
Now we have the KDVA veterans.
Great job, man. How you doing, sir? Good morning, Chairman. Good morning, members of the committee, subcommittee. If you give me a second, let my team get situated.
Introduce yourself and begin.
Yes, sir. Again, good morning, Chairman and members of the subcommittee. My name is Commissioner Whitney Allen of the Kentucky Department of Veteran Affairs. I have with me today, and I have them introduce themselves.
My name is Mark Bowman. I'm the Executive Director of the Office of Kentucky Veterans and Urban State Veterans Home.
Sam Ruth, Commissioner of Facilities and Support Services.
Are y'all's mics on? Is it green?
Yes, it's on.
Okay, thank you.
Scott Baker, Executive Director, Facilities Support Services.
Once again, thank you for us to have the opportunity to talk to you today. If you do not know about the Kentucky Department of Veteran Affairs, it's an 800-plus personnel agency dispersed across the great Commonwealth of Kentucky. It consists of 4 veterans nursing homes or centers, 5 cemeteries, state veterans cemeteries across the state. I have 23 veterans benefit field reps or claims officer that also serve as outreach connectors throughout the state, many of them having several or a dozen or so counties under their belt. I also have a state's program that consists of specialty group programs, disabled veterans program that connects veterans to various disabled veterans to services, including federal VA, as well as our partners in the Cabinet of Health and Family Services and other state agencies. I also have a women's veterans program that reaches out to the 27,000 women veterans across the state. I also have a program it's called KY Vets, the Veteran Employment and Training Services program, which connect veterans or in reverse companies to veterans to power our great state economy. And we have many, many other programs, including inward into the Commissioner's office. This year, we're asking for a budget to continue to support our operation and supporting veterans. FY 24 to 25, over $124 million. And then 25-26, $135 million. I believe that the budget has been submitted and all of the line items are available for you to see. And it's basically to maintain those services and take care of our roughly 300,000 veterans and their family members, which our agency impacts about 1/4 of the Kentucky population. And if you know about the Good Works, for example, the benefits division with my VBFRs, the claims officers, currently we're on the road. We have 36,000 veterans and spouses or widows, independents, kids that we serve, generating roughly $38 million a month or $460 million, but $450 million in compensation pension and entitlement for veterans. So that's money in their pockets, tax-free. For many, that's a life-saving life-saving money. For example, you have a Vietnam veteran who was a cab driver after he left service, living on Social Security, which is roughly, $21,000 just around the poverty level, impacted by Agent Orange. If we get him his claim and he's 100% disability, he gets $36,000 a year. That brings his income from $21,000 to $57,000. So he goes from poverty level, just living on Social Security, to the level of two-income family in Louisville. That's the impact that team does. Mark's team does a great job in the center of taking care of our most vulnerable veterans. These individuals need specially health care services and love. Some of them do not have anybody, so we become their family, and we take them from the moment that they walk in the doors, take care of them for life, and when they pass, it's like losing families. We've had veterans that have lived there close to 20 years in our oldest home, Thompson Hood. So in our acts, particularly for additional budget requests, is to expand those services or ensure those services are covered. Particularly with our new Bowling Green Veteran Center, we're looking for an ABR, additional budget request, to hire the immediate staff to get it going in 25, correct, Mark?
We open in late 24.
Late 24, okay.
Late 24.
Yeah, so that will start up the skeleton staff to get things going, doing the major hiring and everything we need to get that facility going. We're also looking at strengthening in two areas that are very unique, at least one. And I know I'm short on time, but probably doing acts for burial honor guard increase, and you may wonder why is the case. So we do over 1,500 services for veterans, burials or interments, and each of them requires, or we try to require, some type of honor guard military presence there. The active duty force is limited in number. They're fighting wars, or now is preparing for or deterring war. So sometimes we have to depend on National Guardsmen, and they have full missions. And we usually get support from our veteran service organizations like the VFW, the DAV. And in that stipend, up to about $60, if I'm correct, to help them with their travels, and they do 4 or 5 military ceremonies a day. And because of the increase in inflation, we're looking to increase that a little bit and ask for additional money to support that. Without those great veterans doing those service, veterans that pass are not properly honored. But the key part of the budget I'd like to talk about is our capital plan, and that is investing in our veteran center or nursing home facilities, as well as our cemeteries. Action around $29 million and over the next 2 years, and $5 million of it is done with federal funding, particularly with our cemeteries. But the key in investing in our veteran centers is to get them Thompson Hood over 30 years. Want to upgrade the facilities to match the standards and quality of living that is going on today. A couple of roof repairs, many of them gone past their life cycle, as well as simple things as fixing lights and other systems. And Mark, do you want to add anything?
No, I'll wait for any questions.
Okay, good. And I understand I'm pressed for time. I'm just sorry that it's so much to cover. I could read the whole book, but I'll just do the touch-up on that and take questions.
Well, thank you very much. I know you're talking quick, and I would like to listen to you all day because you do such good work. So does any members have questions? Where are the census numbers in the veteran centers?
Sure.
These are fresh off the press numbers. Currently at the facility in Hazard in Eastern Kentucky Veteran Center, we're at a census of 80 out of 120. That represents a 67% census. Just as a comparison, and show that we're coming out of what I consider a recovery period out of COVID and a long drought of really some difficult times. So in comparison to 2022, at that time we've gone from 66 veterans to 80 per day, from a 55% census to a 67% census. It's not filling up as quick as any of us would hope, but it is showing what I call moving the needle in a positive direction. For Western Kentucky Veteran Center in 2022, we were at 53 with 34% census. Currently, as of today, we're at 66 at a 42% increase. So we're bringing up the recovery there as well. At Radcliffe Veteran Center, last year we were at 37 veterans at 31%. Today we're at 58 at 48%. Again, trending upward. Thompson Hood, the last year was 99 veterans at 35%. Today we're at 125 at 44%. So those are fresh numbers in comparison to last year.
And sir, to add to that, and Mark presented an interesting point, COVID, as well as we know the shortage of healthcare professionals across the nation. So as we're able to recruit new healthcare talent to the centers, we're able to admit more veterans into those facilities.
Representative Petrie.
Thank you, Mr. Chairman. Just real quick, Hazard, I've got 80 out of 120 at 67%, and Western, I caught 66 of how many?
66, that's 158, it's at 42%.
At 42%.
Yes, sir.
58 of how many?
58 out of 120 at 48% census.
And Thompson Hood 125 of?
At 44%.
125
It's 285. 200, I'm sorry, 285, sir, I apologize.
And Mark?
And I understand that there can be a COVID effect and a trend up or down or stagnant, but compared to adjoining states, are their rates showing 42, 44, 48% capacity, or are they over that capacity?
Yeah, I think you're going to find a wide variety. And the one thing that, and I will share this with you, it's very... You have to make sure you're comparing apples and apples, because, for instance, my esteemed colleague in Tennessee, they are structured differently. Their pay rates are differently. They're a not-for-profit subsidiary of state government. So there's a lot of factors, and the reason I bring that up is I know for a fact Tennessee has a higher pay scale because of their structure, but we're blessed. And this is part of the recovery that we're seeing now, is the collaboration with personnel and finance and the support of legislatures that enabled us to use some tools this last year, including the locality premium and the movement from nursing from what we would consider a sub-market wage. They allowed us to go to the special entry rate, which puts us in the competitive market. It is after those efforts and the allowance for us to do that we started to see this incline. Up until then, we were very stagnant.
Yeah.
Yeah.
Just very quickly on that stagnant part, that's where I'm headed. So pre-COVID, were we much different on the percentages?
Yeah. So at pre-COVID, we already started to see the inability to fill some vacancies. So
Okay, when we're pre-COVID, where we're at 50, 60, 70, 80%, or are we still in the 40, 50 range?
No, we were higher.
Significantly higher?
I'll pull it up for you if you'll give me just a
Sure.
moment, sir. So really pre-COVID in 2019, Thompson Hood was, they were at 56% census. Eastern Kentucky in 2019 was at 91%. Radcliffe Veterans Center in 2019 was at 55%. And Thompson Hood in 2019 was at 56%. And in 2019, Western Kentucky Veterans Center was at 57%.
Yeah, that I find concerning. My understanding is those capacity usages have been stagnant for a pretty good while. Let's go pre-COVID. And if we're talking about 57, up to 60% 3 out of the 4, and that's being generous, but 60% usage out of 4 facilities, there's a lot of lost opportunities at that point in time, and for which I don't recall anybody coming to me in any capacity saying we've got issues, we're not using all our capacity, we need X, Y, and Z in order to move. Now, those conversations could have taken place, but even till this day, I've not heard that.
Yes, sir. And with all due respect, I'm not sure what committees you were involved in, and I apologize that I don't have that information, but I think the record will speak very clearly. For many, many years, we've been talking about the difficulty and the challenges, not only for us, but statewide and nationwide. This is not just an us issue. So, and again, out of respect, we have been clearly on record, and I think you all listen as well as everybody else, not only for us as an agency, but for other agencies and departments throughout the Commonwealth with the changes that happened this last year.
Well, I've moved rooms 3 times since I came in 17, but I'm still easy to find, and I'm pretty familiar with budget requests that come in from the agencies. And I'm going back to those for the last 3 or 4 years, and I'm not recalling anything in particular, but I'll go back and look again. Thank you.
Yes, and Chairman Petrie would be the fellow that you need to talk with. So,
Be glad to.
So, Representative Johnson.
So I guess I'm going to go along the same lines. That's what this committee is about. Why exactly? Give us some information as to why those rates are so low. What do you need?
Well, as you know, we follow the 18A pay scales, and those are established with your all support and approval ultimately, and so we go with those pay scales. And up until the advent of the locality premium, and then also with your all support several years ago, we tried to look outside the box and say, look, if we can't be competitive in the 18A system, we changed some regulations that allowed us to use personal service contracts, which is really, instead of going and putting money to agency use, which healthcare providers unfortunately sometimes have to do just to be able to take care of their veterans or residents, and nobody likes that. It's money we'd rather spend somewhere else. So we even went to and expanded the regulations at that point to include our nurses and then later nursing assistants. So what that did, it allowed us to pay a higher wage for those that didn't care or didn't want the benefits. It was that more immediate take-home effect for them, which allowed us to pay a higher wage. So with the continued efforts to try to bring about and support changes in the 18A system, which were culminated this last June and July, along with PSC contracts, we were doing everything we can, including with your all support, we instituted a nurse loan repayment program. I mean, we've been looking outside the box and trying to come up with solutions. It's not like, this is an ongoing issue for us for many years. And what we have found, and I think it's true across the healthcare sector in general at the national and state level, there's no one solution to this. If there was, everybody would do it, we would do it, and we wouldn't have this issue. Because there's 2 issues that we're passionate about, and I know you all support that, is caring in a quality fashion for the veterans that we have, and then trying to get back and improve access, because that's what we exist for. We exist to take care of them and provide access.
And thank you, Mark. Good answer. And sir, I support the efforts that the Personnel Cabinet is doing as enterprise-wise to make state government attractive. Mark has done a great job in establishing new partnerships. Great example, K-State is doing clinical work, or at least their students coming over, volunteering to do clinical work. The biggest thing we ask you to do is don't ask us to drop our standards. All our centers are CMS 5. Okay, and that's a very hard. It could change tomorrow. I know Mark cringed when I say it, but it could change tomorrow. And we put in a lot of effort and stayed at the highest standard to take care of our veterans. The veteran centers and homes is not a nursing home factory. Okay, and I think you all have seen the worst homes. I've seen relatives in bad homes. When I walk into my homes on a regular basis, I've even cleaned toilets. He can tell you in those places with the staff. It is love and care. Okay, when a veteran dies, everyone cries in that facility. When veterans were dying, and we had one of the lowest rates in the country for those who are passing there for the extreme, they call it extreme, but the great measures that he and my veterans team
We have one more question.
Okay, but I just want to highlight, do not ask us to drop our standards. We're doing everything possible. We're recruiting. We're admitting people as we can, and we have the support of the personnel cabinet and the whole team. And I look forward to your support and us getting there. And Mark, just how many people were admitted this year?
Oh, well, the total is right around the 150, and then we've lost 90. So the net gain is very difficult because we get people when they're the sickest of the sick.
Representative Branch.
Radcliffe, you have a facility in Radcliffe, right?
Yes, sir.
And what is its capacity right now? Can you whip that out again, just ballpark figure?
Radcliffe is currently at 48% census with a total of 58 veterans.
Now, so that means 100% is what you could handle, but you have 48 right now. Is that fair?
That's correct, sir.
I have a constituent who says that for 3 years the air conditioner has been broke, and that's the excuse that they can't have people come into there. Does that ring a bell with you?
Yes, sir. It sure does. So it's. I think a better phrase would be we started having issues. It's a facility opened in 2017, and we did start having issues 3 years ago with our HVAC system, and it continued. The repairs continued to be required, and it was under warranty. So all the warranty parts were being done, and it picked up. Really, it started escalating more so than we probably would ever expect in a new facility. So in late 22, it got to the point where he said something it's wrong. Something's wrong with this. So we had a company that came in to assess that, determine what's going on with that system. And the bottom line is what we found out in that assessment is the product that was installed in that facility was a Samsung product. That product was removed from the marketplace. So for whatever reason, there was clearly a reason that somebody removed that from the marketplace, but we're in that facility. So we've always been able to maintain, and this is why I just wanted to kind of clarify, we've always maintained the temperatures in the areas that we have veterans in. But there's no question that until we get that fixed, the expansion into those two other neighborhoods.
3 years?
It started 3 years ago, yes, sir.
And you've been turning veterans away for an air conditioner for 3 years?
No.
That was my question.
Yes, sir. And it's not just an air conditioner, okay? It's a ventilation system. It's a heating system. According to CMS, Medicaid standards, federal standards, we have to regulate the temperature between 71 and 81%. So it's not just a simple air conditioned system. If y'all want to say a few words about anything about this process, Mark, we have done everything to try to make sure the system work. But the most important thing I've asked everyone in the past is all about safety. Let's say we move people in there and one of the area goes down, especially if they're traumatic, has dementia, things of that nature. That's a traumatic experience moving a veteran just from one room to the other. So there's been challenges with the system. Everyone has done everything in their power to make it work, and we're just not going to put veterans in harm's way. It's more than an air conditioner, sir. That's the bottom line. It is a life support system, basically. Can't think of a better
How
term,
many
but
veterans do you guys turn down a year?
There's certainly in the last 2 years I can find the number of how
Just
many
ballpark
returned.
it for me.
Well, hold on, sir. Be more specific. They're not qualified.
Because you
to
don't,
that.
okay,
Yeah.
because they're qualified, but you don't have room for them, or
Yeah.
you don't have the capacity for them.
So if I may, sir, if I want to backtrack, because I want to make sure that I clarify in no way, and currently we are not admitting beyond that 60 until we get that issue resolved. So I want to be very clear and upfront that is the case
Can
currently.
you get back with us on, you should be able to get
Yes.
a budget thing or an estimate from someone what that will cost and what time it would do from construction companies and that. Can you get
Yes.
back with us?
Yes,
on
sir,
that?
we are, 'cause
And
we're-
then any answer to
Yes.
Representative
Sir,
Bratcher
it
on
is-
how many people you've
I'm
turned
so-
down and why?
Yes, sir. Sir, it is in our budget request to get the money to replace the system.
So you do have an estimate of what it will cost?
Yes, sir. And then,
And a time frame of
we can
when
get it to you.
when it would be done if you had the money?
Yeah, so
Okay.
We've initiated the RFP for the design for the new system. That's underway. And then as soon as the money is appropriated for the replacement system, hopefully in.
Well, initiating the RFP doesn't mean you actually have a firm estimate yet.
Well, we've received an estimate in the 2022 study that was done.
Okay.
That's what
can
we
you,
based
Can you
the
send
budget
that to
on.
us? And also the request of Representative Bradshaw on how many you turned down and for what reason?
Yes, sir.
Okay.
Be
Well,
glad
thank
to.
you very much for coming. We appreciate it.
Thank you.
And next
Thank you, sir.
Next we have Unified Prosecutorial System.
Two chairs. I'm gonna sit over here and advance the slide. Joe's gonna sit right now. Okay. Perfect. Slide, ladies. On? Yes, it looks like it. Good morning.
Thank you. Make sure your green light's on. Introduce yourself and start.
Good morning. I'm Stacy Tapke, the Kenton County Attorney and a member of the Prosecutor Advisory Council.
And I'm Courtney Baxter, Commonwealth's Attorney for the 12th Judicial Circuit, and I'm also a member of the Prosecutor Advisory Council.
I'm Joe Ross, Logan County Attorney, and I'm also a member of the Prosecutors Advisory Council.
And I'm Gina Carey. I'm going to advance the slides.
Are you ready for us to proceed? Good morning. Thank you so much for having us here today to present. Also like to recognize another member of the council, Jenny Oldham from Hardin County, who's with us here today. We are lawyers, so we're not particularly good at math, so we are very lucky to have Ms. Gina Carey with us here today, who helped us prepare the numbers that we're going to be talking about. And we'd like to thank them for all their support. And we want to talk about the Prosecutor Advisory Council budget. We refer to it amongst county and commonwealth attorneys as PAC and the PAC budget. And we're going to talk first county attorneys, and then I'm going to hand it to my colleague to talk about the commonwealth's attorneys. But the PAC budget allocates the funding for each county attorney office. 96% of that budget is for our personnel. Each office budget allocates funds for positions that are used to represent the Commonwealth in court on traffic and misdemeanor cases, dependency, neglect, and abuse cases, juvenile prosecution, as well as guardianship, Casey's Law, Tim's Law, and involuntary hospitalization. Each office also receives an annual operating budget of $8,000. Most offices, including my own, have to supplement the PAC budget for both our staff and operating costs through our delinquent taxes and traffic safety programs. Our base budget supports our staff for all 120 counties and also provides the funding for our House Bill 8 payments, which we appreciate that funding was allocated. And it also supports funding for our Rocket Docket staff, a program which this past fiscal year we estimate that it was a savings of about $30 million to our local jails. We also greatly appreciate the additional funding that allowed us to upgrade our 87 positions, or add or upgrade, and that's become more and more important, particularly as to our victim advocates. We're seeing the federal VOCA funding decrease year after year that used to provide the sufficient funding for those positions. Many of our offices, however, are still without those victim advocates. Even the amount that's being offered, the salaries, those positions aren't being taken up. And we really hope and think, especially with mercy law obligations, that those need to be funded, and hope that every office is able to get fully staffed on victim advocates. Unfortunately, despite your investments in us, hiring is still a big challenge. We currently have a vacancy rate of about 12%. We're seeing a lot of turnover. I know I'm seeing a lot more of lawyers coming in, spending a few years, and then we're losing them to the private sector. We're also losing them to other governmental agencies, and I'm across the river from Hamilton County, Cincinnati. They start people at $85,000, and I just can't compete with that. Our law school pipeline also seems to be shrinking. We're not seeing as many law clerks, and we're just not getting resumes and candidates who are putting in for our positions. Finally, our budget request also includes some funding to get us to our 2020 salary compensation report, which we did and presented, and I think that's in all of your materials. And again, we don't have at the county attorney level, there is no starting salary. It's really based upon whatever budget funding you may have and whatever, again, supplemental funds you can put together. Also, we're requesting some funding to help with the requirements of the Senate Bill 90 pilot program. The money that was allocated to that program did not include any funding for prosecutors or our responsibilities when we're doing those reporting and managing the cases. So at this point, I'm going to turn things over to Courtney.
Thank you, Stacy. And again, I'll remind you, I'm Courtney Baxter, the Commonwealth Attorney for the 12th Judicial Circuit. I appreciate the opportunity to be here to discuss and answer any questions regarding the proposed budget of the Commonwealth Attorneys for the 2024-2026 fiscal year. The Commonwealth Attorney's Office is responsible for presenting cases to the grand jury, and it's approximately 3 times per month, depending on where and what jurisdiction you're in. We're averaging over 52 cases per grand jury, but that doesn't include the number of cases that we review in a given month to determine whether or not they are ripe for prosecution. And we are in charge of prosecuting the most serious crimes in our state. Our base budget, which we provided for you, and it is in the slideshow, is essential for us to maintain our offices and be effective in prosecuting cases in the Commonwealth. But the base budget, we do have some additional requests because we are still continuing to have issues that we deal with in prosecuting our cases. And I'm not going to get into the specifics of the actual numbers that we're presenting to you, but I did want to discuss with you our greatest concerns as it relates to our budget. Even with our salary increases, which we were very thankful for over the last budget cycles, we are still experiencing attrition and turnover, and currently since January of 2023, we were at 15%, but it's now predicted by the end of the year that we'll have attrition or turnover at 20%. And like the county attorneys, we are dealing with the same issues, which is we can't compete with other agencies or the private sector in terms of being able to compensate our employees. The workload is heavy. We are dealing with burnout from the COVID backlog and such, and we aren't able to compete with offering remote opportunities because in the criminal justice system, that's just not feasible. We're in and out of court, we're trying cases. So those are some of the issues that we're dealing with in dealing with attrition and turnover. We believe we can address this issue with a salary compensation standardization that provides a salary compensation plan with guaranteed salary increases each year. And we have actually previously proposed this in 2020, so you all have had that information since then. And also, we feel with the addition of additional staff that this can help with the stress and the workload that our current employees are dealing with. Now, we are, like I've said, we continue to deal with a backlog of cases from COVID, and we've seen an increase in violent crime. This backlog and the increase in the most serious cases have strained our time and resources and the need for more staff to effectively prosecute these more complicated cases. In addition, the passage of Marcy's Law has also increased our workload due to our increased responsibilities that is required by our constitutional law. All the offices do not have victim advocates. Some of the offices had their federal funding, as Stacy said, cut through VOCA, and we are requesting funding so that we can ensure that those offices have the advocates so we can meet our constitutional responsibilities. In addition, the uncertainty to the rocket docket funding from the Justice Cabinet can be alleviated by making the funding a permanent general fund appropriation in the budget. This program has been instrumental in saving millions of dollars to the counties and the state and has streamlined our low-level offenders into treatment rather than jail or prison. We've completed over 48,000 cases with 38,000 referred to treatment. This permanent addition will ensure the continued funding and success of this very vital program of the criminal justice system. And this leads me to the recent passage of KRS 202C. It's the involuntary commitment hearing statute that has put a significant drain on our expert witness funding. This statute requires the Commonwealth to retain mental health experts for evaluation and testimony at a cost of approximately $13,000 per case. It's vital for prosecutors to have access not only for involuntary commitment hearings for expert funding, but also for our very serious cases that we try. We got to have funds to effectively prosecute that case, and it's essential for public safety. Now, our witness protection program has not been funded in 20 years, and the balance is now below $10,000, so we're asking for a general fund appropriation to address this shortage. And then finally, currently, we do not have what is called a universal case management system. Believe it or not, some of our offices are still using paper, not any electronic means to, provide our discovery files to defense counsel. So with advanced technology, including body cams, cell phones, geolocations, and Marcy's Law responsibilities, a universal case management system is critical for our offices to store, access, and share information easily between the agencies. This will not only make the criminal justice system more efficient, but result in the better use of our staff's time and allow us to focus on matters essential to criminal prosecution.
Have you looked into your case management?
Yes, we have. We have been exploring.
You have ideas?
Yes, we are.
Okay.
We are working with a company right now.
Actually, we're going into the RFP process.
That's right.
We're working with AOC.
Okay, all right.
Thank you, Gina.
Sorry.
This leads me to the request to increase the number of PAC positions, which is the Prosecutor Advisory Council that supports our offices. They do an absolutely outstanding job in supporting 177 offices with 1,250 employees with a staff of only 14. Every day they go above and beyond to provide support to our offices. These additional positions are critical so that PAC can continue to provide outstanding support and address mandates and initiatives. The additional staff is essential to assist in implementing and maintaining our universal case management system once we have one, as well as the increased responsibilities for IT. There are only 2.25 staff members providing IT support to 177 offices. A strong PAC staff translates to top-notch prosecution and ensures public safety, which is our number one goal. And I appreciate your time, and we're happy to answer any questions that you have.
Representative Bratcher.
Just two quick ones. Do you guys do any kind of, like, for young lawyers coming into your bailiwick there, do you pay off their loans or anything if they do a certain amount of time?
There are, I believe most prosecutors, if they do 10 years, I think, in public service, they would have loan repayments, and we do that in my office. That is something that is has been attractive in the past, but it's really just a different environment. There just aren't as many coming to us for even that.
Oh, yeah.
I'm sorry, and it is a federal program. We sign off on, there's paperwork that we have to sign off on to verify that they were in fact employed by us, but it's through the federal.
And ma'am, on the end, what is your name?
Courtney Baxter.
And what's your title?
I'm the Commonwealth Attorney for Henry, Oldham, and Trumbull counties.
You said that one of the reasons you're asked for more money was violent crime increase. Did you say that?
Yes.
Can you address that? Because I hear I'm on 2 judiciary committees, and I hear crime is going down. Is it going down or is it going up?
We are seeing an increase in my jurisdiction and have over the past couple of years.
And that's Henderson?
No, it's Henry, Oldham, and Trumbull counties. The types of cases that we are seeing a lot more when we're folks are being arrested with drugs. There's lots of weapons. We've had an increase, and I think a lot of it's been coming in from Jefferson County, Oldham County borders, Jefferson, carjackings, car theft. I've had an increase.
Well, I see that too, but sometimes people say that I'm just using specific cases, and it's not really an increase in crime. There's a decrease in crime. So, and I'm not trying to get political or anything. I'm just telling you what I hear all the time is it's going down, and you just say you need more money because it's going up.
Yes, we do.
Okay, thank you.
I mean, in addition to just the increase in crime, we do have a tremendous backlog from COVID. And we didn't try cases for 2 years. So that backlog, coupled with the increase in the types of crime that we're seeing in terms of more guns, more weapons, more drugs, that's the basis for the increase in the request.
Representative Palumbo.
Thank you, Mr. Chairman. Ms. Baxter.
Yes.
Thank you all for your presentation. And I hear that crime is going up, especially in my county of Fayette. My question is, you said it's been years since the victim witness protection funding has been increased.
I don't think it's been funded, has it, Gina?
It was originally funded in 1998 or 99 at 200,000, and it's never had any additional funding. It was a restricted fund account
It's 25,000 on here.
per year.
That is not good.
It is not good. You are correct.
So I would be for increasing that funding, Mr. Chairman. And thank you.
Thank you. Representative Fleming.
Thank you.
Thank you, Mr. Chairman. First of all, just to let you know, Representative Baxter, Ms. Baxter is probably one of the best ones I've come across in terms of her intelligence and work ethic and so forth. And so she's really highly regarded in her district. And I want to ask a question just in general. When you say that, Ms. Baxter, are you saying just for your district, or are you saying that for the whole Commonwealth in terms of crime going up?
That is my understanding, that we're dealing with an increase in the types of violent crime that we're seeing.
Okay. All right. I just want to get that clarified. And then this is a general question for the panel. And I guess it goes for the Commonwealth as well as the county. Could you explain to me briefly the current employee evaluation process when you review performance and so forth, and how the increases occur, or what determines those criteria to increasing?
May I offer two things? One, on your previous question, we're seeing in Kenton County at least very serious juvenile crime, carjackings. I mean, very serious. That's where we're seeing part of our increase. As far as employment evaluations and almost like a merit-based allocation of increases is, I think, what you're maybe getting towards.
No, and I'll clarify, because I'm taking that when you say a guaranteed increase, and when you say guaranteed, that gives me a little bit of a uneasy feeling, because that means it's a cookie cutter and everybody gets it, because we don't look at the performance of the individual, and it's more everybody gets it. Gets an increase no matter what they do, because Representative Brasher might do a bang-up job, and he gets X, and I do nothing, and I get the same amount as he. And that's not fair. I mean, we got to give the employee enough incentives in order to do the job the best way they can. And that's when you say guaranteed, I get a little concerned about that type of terminology.
I believe part of it is to just move towards that 2020 classification study, so that you're kind of seeing positions, all the same type of positions, salary ranges, that sort of thing. Right now, the only time my staff typically ever get an adjustment is when someone who makes more money than them leaves, and then they've moved up, because I only get that pot of money that is allocated, and I have to divide that up amongst my positions. And unless I add to that pot from those other two funds that I talked about, I cannot keep people. So historically, that's really the only time you ever kind of saw an adjustment, was when somebody else who was higher up moved on, so that you could get a little bit of every
when you can fill the positions and then you can get rid of the ones you don't want and fill them with better people, it'd be a lot better. First, we have to fill the positions before we can start doing Representative Fleming's merit system to the full extent that we would like to.
To his point, we currently do leave it up to the elected to allocate any additional funds. I will state the last two budget years are the only time we've really had any additional funds since I've been county attorney, and I've been in since 2010. So we do.
But I think it might be a good thing if you could come up with some kind of a system where the ones that are working the hardest get a little bit more money. That would.
We have that ability now, though.
Yeah.
You do?
We do.
You have that system now?
Mm-hmm.
Yes.
Yes.
We get a raise.
Can
for
you
the
give a
office.
synopsis to Representative Fleming
Well,
on that?
we don't have a written standards, but if we recognize somebody's doing better, they can get a higher percentage raise than the rest of the staff.
Well, there has to be some kind of policy on that, not just you like so-and-so to do that. But anyway, well, I don't want to get into that right now. Thank you for your testimony, and I appreciate you being very quick with it. We could go further, but.
We could.
Thank you.
Yes, thank you very much.
And now we have Personnel Cabinet. And if you introduce yourself and begin.
Absolutely. Thank you so much. Good morning. I am Mary Elizabeth Bailey. I'm the Secretary of the Personnel Cabinet.
I'm Robert Long, Deputy Secretary.
Good morning. My name is Jamie Caldwell, and I'm the Commissioner of our Department of Human Resources Administration.
Okay. Great. Well, we are here today and very excited to say that we have completed the compensation review study of our job classifications. We have presented the report. I hope everyone has had a chance to review that. I know it was due yesterday, and we did comply with that. It was an extensive review of over 1,300 job classifications, which encompassed around 26,000 employees. It took a tremendous amount of time by our staff of 5 individuals, along with our assistants from our consulting firm, Korn Ferry, to do a comprehensive review of our classification and compensation system and the job classes, and looking at all attributes of the job class, minimum requirements, characteristics of job duties, working conditions. We looked at everything that dealt with the class specification. In addition to that, we also looked at the market. We understand that a lot of our job classifications in Veterans Affairs was here, and they just testified on their nursing series. We have had, as you all know, the market is very, very tight with that, very competitive, and we have had a lot of challenges that, we've been able to review market data on a lot of our job classifications. We have survey data from our neighboring states and from our National Compensation Association of State Governments. We received a lot of data from them, looking at them. And we looked at a lot of our localities, at our local governments. And, we've been able to review the job classes and been able to set special entrance rates on job classifications. We've been able to set locality premiums. That is something that, we have heard from, members of the General Assembly, and we have noticed ourselves, not everyone in every single locality should or will make the same, because it's competitive, maybe more so in Jefferson County than it is in another county out in the state. So we have set a lot of locality premiums on our job classifications. So those areas are paid at a higher rate to be more competitive. In the job classification report, we have provided the General Assembly with several recommendations. One thing I do want to say is, thank you very much for allocating the funds for our 8% and 6% increase. That has gone a long ways in addressing a lot of the compensation issues that have occurred over the years. Also want to thank you all for allocating the $500,000 for us in House Bill 444 for assistance with our consulting firm to be able to complete this project. It was a tremendous amount of work, so I thank you for that. I want to get into reviewing the recommendations that we have set forth in the report. The first one is the comprehensive review, as you all know, of all the job classifications. With our existing funds in the agencies, we have been able to implement majority of the changes to the job classifications. Right now, as we stand right here, of course, I said we have reviewed over 1,300 job classifications that we had. Within that, 348 of those job classifications received a pay grade change. What does that mean? That means that a job either went up a grade or two per se based upon our point factoring system. And with that, all current employees received a 5 to 10% raise, depending on the job class. And that impacted over 16,000 employees have already received that. So a tremendous amount of work has gone in there. In addition to that, 755 job classifications out of the 1,300 received some type of revision to it. Like I said, minimum requirements, examples of duties, characteristics of the job, working conditions changed. So a lot of work went into analyzing the job classification. Additionally, this review was needed. It was something that we were very proud to work on because, we were able to, in working with the agencies, because this is not just a personnel cabinet endeavor. We, on each of the job classifications, it is a partnership with the agencies. They are doing reviews along with us. We are working with their subject matter experts. We are getting their feedback. We are looking at the data. We established 77 new job classifications to meet the needs of agencies and to be able so they can fulfill their missions. But in addition to that, we abolished 227 job classifications, ones that were no longer needed or that were the duties have been consolidated into another type of job class throughout the years. So with that, on that recommendation of the job classification review, we understand that of the $200 million that was set aside, we still have around $72 million that is still left to be allocated. We are going to need additional assistance from the General Assembly on some of our job classifications, and that has been noted in the report. We are needing to set additional special entrance rates on our social service worker job series, social service clinicians, the probation and parole officer job series, classification and treatment officers, corrections unit administrators, and our information technology series. We, as I said, majority of the review has already been implemented and effectuated, and with existing funds in agencies, we were able to make those compensation changes with what we are recommending for this job series that we have listed in the report. There is not enough money in existing budgets to do that, so we will need assistance from the General Assembly, around $17 million from that 72. We are asking for those job classifications. Our next recommendation is something that we have all heard. We have experienced it ourselves, myself and Deputy Secretary Long and Commissioner Caldwell. We are all career employees and have been around a long time, and we hear this term compression. And we get a lot of feedback. I know you all do from your constituents because I hear from you. Employees contact us constantly and say, I've been here a long time. We've got a new hire. They're making as much as me. This is not fair. Completely understand that. And that is just a byproduct of years of not getting incremental increases each year, either a cost of living or an increment or something across the board. Right now the law ensures that when a new employee is hired, they will not make more than the current employees, but they can make the same. And we have to give the agencies the flexibility to be able to do that, to recruit in a lot of our hard to fill jobs. So right now, what we are recommending in the compression increase adjustment, we are asking for, out of that $72 million again, $55 million to be allocated to a compression increase adjustment, and that is going to be a percentage range based upon months of service, seniority, for continuous months of service. So we know the population that has continuously worked for state government for more than 13 years, they missed an annual increase out of the last 10 to out of 10 out of the last 12 years, so prior to the previous two. So we, are looking at doing, the highest amount for that group, and then a tiered down approach based upon your continuous month of service from there, to try to make a gap, make a range there for your senior level employees that have been around a long time, so that to ensure that now they are set up higher than those that are new hires, and try to alleviate this compression that we are all feeling and dealing with. So that is a significant recommendation from us. In addition to that, we are recommending we need to continue to receive an annual increment or across-the-board increase or a cost of living for state employees. Number one, this alleviates the compression issue that we all hear about, and so that is something that is needed. We also need to ensure that each year that we are continuing to adjust our salary schedule. We have done that the last 2 years. Thankfully, we have adjusted the salary schedule based upon the percentage that the across-the-board increase that was given. So it was adjusted, our salary schedule, the minimum was adjusted 8%, and then it was adjusted 6% this last September after the July 1 increases. And so we need to continue to be able to raise that salary schedule to be able to recruit in state government and of course, retain our current employees. But for recruitment, it is just very important that we are able to continue that salary schedule adjustment. In addition, as a new tool for recruitment, we are also asking or recommending a student loan forgiveness retention program. That is something that we have a lot of, we just talked about Veterans Affairs. We do hear that from nurses and from some of our other professional job classifications. Employees are looking for assistance with their student loans and are asking, for that, asking if we have a tool like that in state government, and we do not. So we are requesting that to be able to establish that new program. Additionally, we are recommending we are having issues, of course, in recruitment in our hazardous duty in the state police retirement plan. We are asking for the Tier 3 retirement plan to be reinstated back to Tier 2 for recruitment issues, to assist with that. And then our last recommendation, which has been really highlighted over the last couple of years, is we are asking for pension spiking legislation review. Right now, all of these increases, the across the board, the 8 and the 6 we just received, plus any of the grade changes that we are implementing, any type of salary adjustments, these locality premiums, anything that we are giving to employees to increase their salaries are something that are not excluded in the pension spiking. So everyone is spiking at the time of retirement. So we just ask that legislation under KDVA be amended so that employees are not impacted by these adjustments that are, to no fault of their own or that they cannot control. So.
Well, that has been discussed, and I'm not sure that it would apply with automatic salary increases. The pension spiking has some little details that we'd be willing to work with you on that, because I'm not sure you're totally right on that, but we want to look into that.
Yes, please.
You pretty much done?
I'm pretty much, yes. I know for the sake of time, I was trying to rush.
Okay. Thank you very much. I have a few questions if time, but we'll let everybody else first.
Yes.
Representative Palumbo.
Thank you, Mr. Chairman, and thank you for your presentation.
Thank you.
I know your job is very difficult.
Yes.
But I'm receiving a lot of emails from current employees who perhaps have been there 20 years, who are receiving the same salary, but a new employee comes in receiving the very same salaries. Is there any way you could give a bonus to the current employees when a new employee comes in making the same salary? I just thought about that. If there's a way to compensate those who've been loyal and faithful for so many years.
I think one thing we should do first when we do that is understand how you are giving them more money? Because within a job classification, there's levels.
In some.
And the way it's set up is you start at one level, then you have evaluations that you can move to different levels. When you hire someone that you want, the way you give them more money is to start them at a higher level than the beginning, correct? In other words, the beginner's level is here, and you want to hire someone with more experience or this or that, and you need someone for the job. You don't start them at the beginner's level. You start them at a next level or level above that, correct?
I mean, possibly. The thing about it is, in our
Well, how do you pay them more than what somebody's working there if you don't do that?
you don't.
Okay, so
You
that's
don't.
how you do it.
And that's what she said.
Yeah, right. So the question that I have then, do you somewhat stagnate them to stay there while the other ones have a chance to move up to that because they started above what one has already been there? The next is, have you addressed the evaluations, because there for a while state government was, oh, everybody needs a pay raise, and the way to do that is to give them the great evaluation. So you have 1, 2, 3, and everybody was a 3, so everybody got a pay raise. Even though, as Representative Fleming was talking with the prosecutors, is that doesn't mean everybody's actually should get an evaluation of 3. So that's two things that I'm asking. One with Representative Palumbo's is that the way that you actually do bring someone in at a higher rate than someone that may be already working there?
Right now, with our current compensation, and I'm not sure, let me try to explain it and see if this answers your questions. So right now, for when an agency is wanting to hire to fill a job classification, whether it's a level, if you have a series, whether it's a level 1, 2, 3, or 4, when they go to fill that position with a qualified candidate who has met the minimum requirements, they have the ability, we have a pay range for each grade. And so they have the ability to offer a salary within that pay range for that grade in that job. And at that time that they offer that rate, if it is higher than existing employees in that current job, in that same work county, in that same organizational structure, then agencies have to look and ensure, does the other people that they have to compare the new hire with existing employees for a combination of education and experience. If the new hire has less than per se the existing employees, then everyone is raised up to that new hire, so no one is making more. So there's not that ability. So I'm not sure if that answers your question or not.
Well, I was wanting you to explain. I understand it because I went through it. I was in the cabinets.
Oh, I remember.
And I know the levels.
Yes.
And I know, say, you started out at the beginner's level, and then I came in at a higher level.
You mean like if it's a series, a 1, 2, 3, and a 4.
Right.
So if an agency needed to fill a level, each job is looked at individually. So if someone out.
Well, here's what I'll ask you to do. I understand it, but it's very complicated.
It is.
Is there a way you can make it more succinct and understandable for the committee and bring it back to how it is actually done? Because I understand it is what is intended is you have a range. You bring them in at the low range, and then with evaluations, and move them up to the highest range.
No, sir. Evaluations, we do not have pay for performance. Evaluations are not tied to your pay. So it is tied to when you are promotional abilities. It is looked at, your record of performance is looked at when you apply for other positions, but it's not tied to your pay.
Okay, well, we'll discuss that offline because you do have to have a way to move up to the highest level.
Well, that is based upon minimum requirements and whether or not those, if it's a series that you can be reclassed between the levels. Are you performing the duties? Have you had a material permanent change in those job duties?
Right.
That is, what we look at, and the minimums.
Right. So if we're getting a lot of complaints. and most of the members don't quite understand how it's done in the cabinets. So we need something a little succinct in that we can understand, as you and I do, on how it actually does work and why that happens, and how we can maybe offset it and help you with that. Okay.
Right.
And now we have a question from Senator Thomas.
Okay.
Secretary Bailey, it's always good to see you.
Thank you, Senator. Appreciate it.
All right. I've been on a committee this entire summer that has looked extensively and continuously at the juvenile justice issues we faced.
Yes, sir.
And hiring new juvenile justice officers, and really to tangential extent, the corrections department in general.
Yes.
And what
we have worked with them extensively.
Wow, I've heard testimony extensively on this.
Yes.
And one of the biggest problems that has come up over the course of the entire summer, meeting after meeting, is that we can attract employees, since we've raised the pay to $50,000 now, in certain areas of the state. But when we talk about Louisville, Northern Kentucky, we're still having problems getting quality people to come fill those positions.
Yes.
And so the issue, you talked about locality premium.
Yes, that would.
And I want to hear more about that. And really encourage the state from a personnel standpoint to look at pay differentials in certain markets, because some markets have a higher cost of living than others. That's just the reality of our state, reality of our nation, really.
Absolutely.
And so I really want you to take a look at that and see how we can work out locality premiums so that we can get competent people to come work in our state, or wherever the needs arise.
Yes.
And before you answer that, I want to do something real quick because we're running out of time.
Yes, sir.
I'd like, do we have a motion to approve the minutes?
To move.
All in favor say aye.
Aye.
Any opposed? Minutes are approved. Now, go ahead and answer the question. We'll move on. Thank you very much.
You're welcome. Yes, sir. And as you'll see in the report, we have set locality premiums on numerous job classifications and in counties. And, the report is just not, it's just not a November 1 and it's done. This is work that we are constantly doing. We know the market is fluid. Things are changing constantly. So we, are always working with agencies. That is something that we can continue to work with justice. We are watching their employment numbers and their attrition and things going on in their agencies, and working closely with them. So understand, that is something that we will continue to do, is approach agencies, based upon funds. If we can set those locality premiums, we absolutely will. And Senate Bill 153, has required us to do every 5 years to do this compensation study. So this is going to be ongoing work that we do. We won't just start this again in 4 more years. We're actually, in the midst of starting over and looking at those jobs that we, reviewed 3 years ago. So this is going to be an ongoing work of effort for us.
Well, thank you, Secretary Bailey. And again, you do such great work for our state.
I appreciate it. Thank you
Representative
so much. It's a team.
Thank you, Mr. Chairman. Secretary, I want to ask you, you said you had $200 million, $72 million still remains. Why hasn't that been spent? And then you mentioned something, at least that's what I thought you said. And then you went through a series of other information in terms of $55 million for compression rates, additional $14 million. So I got a little, I guess, confused in terms of what you're asking for in terms of financial requests. Could you do that succinctly in about a minute?
In about a minute. I'll try.
Yes, ma'am.
I believe we are needing the General Assembly to, allocate the remaining money to us to be able to spend that.
The 70 million. So that doesn't roll over. You need to reorder. Okay.
Yes, that's been held. We spent around $111 million on the 6% increase that was given last year, plus some additional increases that the General Assembly had in legislation for justice employees and social workers. We did a few adjustments there. So that was where so now we have that around $72 million is being held right now, and that is how in the report, we are recommending how that 72 million is going to be spent.
Well,
And
thank
that's
you
in
very
the general
much.
assembly
And the
report.
last question is,
Okay.
I know, want you to affirm that you are working on the jobs that are held by the secretaries, just in case they need to fill them that aren't actually filled. And that's always been a personnel cabinet trying to squeeze the other cabinets on getting rid of those jobs.
Yes.
So you are doing that.
I mean, we're constantly reviewing vacant positions, and
I know I was on the end of trying to hold them in case we needed them, and the personnel cabinet was saying, "No, you need to get rid of those." So I just want to make sure that you are on top of the people. That, in case you needed them, and the personnel said, "We need to get rid of those." So,
Right.
Yes.
Yes, sir.
All right. Thank you.
Yes. Thank you so much.
Thank you very much, and we are adjourned.